This is CTV. Don't blink.
Allow me, okay, yes, please go ahead.
I'm honored to represent the directors, the board of MFU, who were given a mandate by the Honorable Minister of Health and the government to carry out advocacy and resource mobilization for malaria. Our goal is to ensure that the necessary resources are available to cover the gaps in the program's priority plans. Last year, we activated a resource mobilization drive targeting private sector companies and partners to raise funds for the fight against malaria. Among the drives was the launch of our first ever malaria fundraising event, the Rotary Family Carnival, which raised 44 million shillings after all the expenses. I want to recognize the organizing team of the Rotary Family Carnival for their hard work and commitment. This event will be hosted annually to raise both awareness and funds for the fight against malaria. Allow me in a special way to appreciate ALMA, that is the African Leaders Malaria Alliance, for the continued effort and support towards a malaria-free Uganda board, secretariat, and activities. I also want to acknowledge our partners who contributed over 134 million shillings in kind towards the annual fundraiser.
Now, talking about malaria, and interestingly, listening to our chairman, this initiative started during COVID. But malaria is one of those problems or challenges that we have had. You know, all of us growing up, our parents, our grandparents, we know we have all suffered from malaria. Malaria has lived with us. Unfortunately, it's one of those that we don't talk about as much as we'll talk about all the other pandemics that we have seen lately. So this is an opportunity for us to elevate and lift every Ugandan's attention to the fact that malaria is still a challenge in our communities. And when we look at the statistics, malaria is still the third, I think, in terms of diseases, highest when it comes to the deaths globally in the world, or globally, yeah, in the world. And for Uganda, about 20,000 Ugandans die every year because of malaria. But it's not only about the deaths, but the impact it has on productivity, on the different communities. Whether it's, you know, a mother or a father that is supposed to go to the gardens, whether it's one of us that is supposed to go and work. The impact on productivity is huge. It's even much more than the number of deaths that we see. And that's why, as EcoBank, we have joined the fight with the Zero Malaria Business Leadership Initiative, which aims at mobilizing the private sector companies to support the Ministry of Health in malaria prevention and control efforts. The initiative is being implemented through the Malaria Free Uganda. You've heard from our chairman, and I'm happy and honored to be part of that team, and working with the technical leadership of the National Malaria Control Division at the Ministry of Health. Through our partnerships, and like the one that Chairman talked about, the last event we had with Lottery Uganda, through Malaria Free Uganda, we are mobilizing a number of private sectors to come and join this effort. In this effort, we have also committed that for all the funds that will be raised, we will match. And today, I'd like to announce that we are matching the funds that were collected, and our match for that fund today is 80 million shillings. That's what we will continue. Like I said, we will continue to mobilize our fellow business community in this country, and every Ugandan that cares enough to eradicate malaria.
Malaria remains one of our biggest problems in this country. Biggest admissions in the hospital. If you went to Kawolo Hospital, for example, you'll find the biggest admissions of cases there are malaria cases. Also among the children under 4. You went to any hospital, health center, it is the same. You go to outpatient attendance, it is the same situation. The biggest number of patients coming to outpatient attendance actually used to be around 25% is malaria cases. And even less, especially among children, it is malaria. So, malaria remains the biggest burden of disease in this country. But the problem is, or the point is, it's also a disease that can be prevented. So, what do we need to do, or how can we work together to address that? We've recently had epidemics of malaria, especially in the, like Mr. Mgisha said, the malaria, the causing mosquitoes didn't go on quarantine. So for the last 3 years, we've actually had epidemics of malaria. And this affected mainly the east, the Soga region, Lango, West Nile, and Karamoja. At one time, we had 70 districts affected, I think around 2021. We've been having a strong interventions to address that, because it was also associated with a lot of cases. We have recently brought it down to below 20, but we still have about 18 districts that we still have epidemics. But the ministry is doing a lot to address that. Madam Grace also emphasized something which we normally do not emphasize a lot, the impact or the effect of malaria on productivity. When you are sick in bed, with all sweating, with all the fever and what, you can't go to work. Even your staff will not come to work. Even the mother will not go to eat or even prepare for actually. But even effect on school going, children, if the child has malaria, she can't go to school. So malaria really has a very big impact beyond just the health sector, the economics, studies, and everything. But as I said, yet this is a disease we can all try to work very hard to prevent. And one of the major interventions we have been using is using the bed nets. We've been doing indoor residue spraying. We've had enough 3 cycles of bed nets distribution in the country, and we are going to start in this year another round of bed nets. And that has helped. Let me first finish the intervention. There is also indoor residue spraying where we spray in the houses, but this is because of the cost has been done only in a few districts, mainly supported by our partners. It was done mainly in West Nile and Lango region in the east, mainly in those districts where the disease prevalence is very high. And then also we have to do larviciding, killing the mosquito larvae in stagnant water, and clearing of bushes and stagnant water around our homes.
Now we all know malaria and the effect it has on our population, especially children under 5, pregnant mothers, and the unborn children. But of recent, malaria is becoming more wise, and it is now affecting the youth and the elderly. So don't think you are safe. We are all candidates for malaria. Since its formation in September 2020, this was during the COVID pandemic time, Malaria Free Uganda Board has made significant milestones. And indeed I must thank the chair, because every time they have activities geared towards not only supporting the fight, but also communicating to the public about malaria. Thank you very much, Malaria Free Uganda. I am therefore pleased that the distinguished men and women of Malaria Free Uganda Board are showing the fact that the private sector can make a significant contribution and enable us to bring down the burden of malaria. You have all heard the amount of money I'm receiving. Don't focus only on this money. We have received much more before, except that the chair did not elaborate everything, including supporting commemoration of World Malaria Days. Thank you, Chair, and thank you for what you do selflessly to ensure that the population of Uganda remains healthy. Allow me, in a very special way, to express my appreciation to EcoBank Uganda for their contributions in this work through the Zero Malaria Leadership Initiative Matching Fund. Your support is invaluable, and I'm confident that it will go a long way in the fight against malaria. As you have heard from the previous speakers, our fight against malaria requires a whole of society approach. All of us. We must all work together to ensure that we achieve our goal of a malaria-free Uganda. The government, private sector, civil society, all have a role to play in this effort. We must all be committed to eradicating this deadly disease. You heard from the DG what we have been facing. Whenever we have epidemics, like the COVID-19, like the Ebola, there is a lot of focus on epidemics, rightfully so. However, we have had malaria with us like forever. I say like forever because when I was born, it was already there, and many other people in the room. So it is like forever. Not a lot of focus is being put on malaria like the epidemics. The reason why is because it is majorly in Africa and in Asia. The other parts of the world don't have it. But they benefit because we buy products to stay alive from them. So it is we who need to put effort to get rid of this disease. Malaria killed more people than COVID-19 in Uganda. And it continues to kill more people than any other disease. The statistics that the DG gave a few minutes ago, unfortunately, have been reversed because of the epidemics we have been having, because of climate change, and because of the uniqueness of the malaria parasite. It knows how to change its antigenic structure when you learn it. So we are now seeing resistance to the medicines that we have, including the artemisinin-based combinations, the coartem that you all know. We are seeing resistance. We are seeing resistance to the pyrethroids and the organophosphates that are used in the mosquito nets and also the chemicals for indoor residue spraying. If you have been observant, even when your house is sprayed, the mosquitoes will visit you. We are seeing challenges even in the test kits. The parasite has learned to dodge the test kits so that you don't see it when you are looking for the parasite. So you may assume somebody with fever does not have malaria when they actually have malaria. So we are going back to the first principles of looking for the parasite under the microscope. Those are the challenges we are facing as a sector. But these challenges are not insurmountable. So when the parasite becomes very wise, we also need to get the wiser. And in coming together like this with the private sector, we are getting the wiser. Mobilizing resources to also do unique things to tell the mosquito parasite, tell the parasite, the malaria parasite, that we are also able to respond. So as a sector, we want to focus on interventions that can yield good results. And one of them is larvicide. Larvicide is about tackling the mosquito where it breeds. But we need the population to also understand that they have a part to play. Your homes should be kept clean, no bushes, no stagnant water. By the way, I will not forget to tell you that those days the mosquitoes used to bite indoors and transmit malaria indoors. Now it is both indoors and outdoors. They always become very wise. So, no stagnant water, bushes down, everywhere clean. And we can do that by communicating. The challenge we have is politics. Because when people are told to do this and they don't want to do it, then they will go to the politicians, forget a bit that I'm a politician. And then the politicians will start saying, leave my voters. But the voters will die. If they don't do the right thing, they will die. So we need to tackle the mosquito at the breeding places. Shortly, we shall be distributing mosquito nets. And we've been doing that for a long time with support from partners like the Global Fund, USAID, President's Malaria Initiative, Against Malaria Foundation need change because the mosquitoes learned the chemicals and they became the wiser. So we have also become the wiser and we are using combinations of chemicals in the mosquito nets. So the ones we are going to distribute beginning the month of March are unique and there are 3 different types. Our message to the population is to consistently sleep under a mosquito net. Right now, it is extremely hot, and many of you are dodging the nets. Please sleep under a mosquito net, a treated mosquito net. If it is too hot, you can use your birthday gown, but stay in the net. Stay in the net and tell all your people to stay in the net. When I talk about consistently, some people think you can sleep in the net today. We also routinely distribute nets in antenatal clinics and child immunization clinics. So they have the nets. But they are not doing it because the recent survey showed us that, is it only 56%? 56 to 60% of our population use the bed nets. We need more information to go out. Even when we have challenges with the chemicals for indoor residual spraying, we shall not give up. We are continuing to address this together with the concerned bodies, the WHO and many others, including addressing the RDTs that are now a challenge. And I am very hopeful that very soon we shall have answers to some of those challenges. Not in small numbers, the highest mortality currently is in that area. Utaleja, Namutumba, Chibuko, all that area, we are having big challenges. And we need concerted efforts. Shortly, we shall be doing mass distribution of anti-malarials for all of them, and also the mosquito nets. And as we mobilize more resources, we shall intensify larvicide. But you can still reach out, send a voice, encourage them any slight fever health facility. The challenge we have in Uganda when we get a fever, by the way, and that this is for all of us, what we do first is rush to a pharmacy, buy Panadol, and some few drugs and swallow, and then we wait. Now, in those areas when you wait and you continue from home, then you are risking death. We need to get them to understand that their first point of stop is a health facility, where it can be well diagnosed and treated properly. That is a challenge that we have currently.
And the entire total to Honorable Minister. That is MFU with EcoBank, handing over to Honorable Minister.
This is CTV.